Hello friends, I am Dr. Gurneet Singh Sahani. I am an MS MCH Neuro and Spine Surgeon. Today I am going to talk about recent advances in neurosurgery. The first advancement that happened in neurosurgery is operating under high magnification under a microscope. Now this had started about a century ago, but the microscopes kept on improvising and the definitions kept on changing. Presently, the microscope is gone to a certain extent that we can see the flow of blood in a blood vessel in the brain, or we can also see the tumor in a different color so that we can remove the whole tumor in toto. One of the other recent advances is neuro-navigation, which is used for us to reach at the tumor precisely and to remove the whole tumor or remove the whole disease completely with the help of this navigation. Along with that, other advances is intraoperative neuro-monitoring, where the functionality of that part of the brain or the spine is continuously checked throughout our operation so that we can save it and not damage it. The other recent advancement is intraoperative ultrasound, in which during the surgery or after our tumor excision is over, we are able to see whether the whole tumor is removed or no. A similar and a much better way to do this is an intraoperative MRI, where after the surgery we take the patient into the MRI machine which is placed inside the operation theatre and check whether the whole tumor is removed or no. The other recent advances which has happened is the technique of surgery, where our initial surgery of a craniotomy, where we used to remove a large part of the skull and do the surgery, or open the spine completely and do the surgery by fixing the screws, has changed to a smaller and a minimally invasive techniques. One of the techniques is an endoscopic transnasal surgery, which is used for pituitary tumors or craniopharyngiomas, which are present at the center part of the brain. These surgeries are done by using the nasal route and removal of the tumor with the help of an endoscope without having an incision on the skin. The other ways are doing keyhole surgeries, where the whole tumor or the disease is removed by a small keyhole. Such surgeries have come at the spine also, where during the minimally invasive spine techniques, we can just do small keyholes and treat the disease of the spine and also do the fixations of the spine if you require. Now this has changed a lot in the patient. The post-operative debility that the patient had, the patient gets better soon, is out and mobile soon. It's all because of these minimally invasive techniques. Such recent advances have gone further by doing something called as awake craniotomies, where we don't take the patient under complete anesthesia or general anesthesia and operate the patient awake, in which we are able to check his functionality continuously throughout our procedure. Now this advancement has really made a better outcome on the patient. Neurological diseases like epilepsy, Parkinson's disease and so on has been treated now by specific procedure, what we call as deep brain stimulation. In this, we put small electrodes into specific areas of the brain and give stimulation, which allows us to control such chronic diseases and patient to have a normal life. These electrodes are connected to a battery which is placed inside the body like a pacemaker, and this has again showed that the outcome of such diseases and the patients can be very good. Endovascular neurosurgery, in which this is also a recent advancement, where these aneurysms or vascular malformations are treated endovascularly by doing an angiogram without having incision on the brain. Functional neurosurgery, which deals with epilepsy, which deals with Parkinsonism and other problems by doing such surgeries. Neurotrauma, where the cases of trauma are dealt with specific care. Spine surgeries and minimally invasive spine surgery, which particularly deals with spinal problems.
So with all this holistic approach and specific advancement, we are able to deal with neurosurgery and give a much better outcome to the patient. That the previous myth or the misconception that the patients after neurosurgery don't recover is quite untrue. In Fortis Hospital, we are able to provide you all the facilities and the newer advances for all neurosurgical and spine cases.